But we are talking about dissociative identity disorder today. This was a specific request from somebody. So if you have a disorder you want covered in the next series, that's going to be much more studio quality and edited, etc., then let us know. But I do have to say, these are for entertainment purposes only, not meant to diagnose or treat any condition. If you believe you have a symptom of something or you want to talk to your doctor about it, talk to your doctor about it. That was the punchline, was talk to your doctor. I don't know why I said it 4 times. So, dissociative identity disorder used to be called multiple personality disorder. We're going to get into why it's not anymore here in a few moments. But the diagnostic criteria from the DSM-5 are as follows. This is Lindsay also if you're new. Disruption of identity characterized by 2 or more distinct personality states, which may be described in some cultures as an experience of possession. The disruption in identity involves marked discontinuity in sense of self and sense of agency, accompanied by related alterations in affect, behavior, consciousness, memory, perception, cognition, and or sensory motor functioning. These signs and symptoms may be observed by others or reported by the individual. So, that's A. B, recurrent gaps in the recall of everyday events, important personal information, and or traumatic events that are inconsistent with ordinary forgetting. So again, all the symptoms are, sometimes people can have lapses in memory, but these are extreme, that are inconsistent with ordinary forgetting. The symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning, and the disturbance is not a normal part of a broadly accepted cultural or religious practice. So it's not better explained by like a kid having an imaginary friend. The symptoms are not attributable to the physiological effects of a substance or another medical condition. So this is an extreme form of dissociation thought to come from childhood abuse. Dissociation is a literal shutoff, so it disconnects the individual from their own personal thoughts, their history, their emotions, and their identity. It's thought to be a coping mechanism that allows the individual to literally mentally escape a negative thought or a traumatic event or a memory that's too painful to remember. So with multiple personality disorder is what it used to be called. Again, we're going to get into why it's not called that anymore. Switching is like the most common thing that people think about. It is very overplayed, and dissociative identity disorder in itself is not as common as you might think from media. I know there's thousands of YouTube videos of people like switching to songs, like a song triggers them or something, which very well might be true, but I know in the media it's very overplayed. And switching in itself can take seconds or it can take days. So it's not like an instant like, whoo, I'm different. I'm a whole different person. And that's really where, I'm not making light of it, that's where a lot of the misconception comes in. Because you got, movies and TV and people just being like, oh, hi, my name is Bob. Just kidding. Not anymore. And it's not. It's damaging. So other symptoms are like headaches, amnesia, time loss, trances, self-sabotage, violence, or self-harm. The average diagnosed age is 16. Less than 20% that are diagnosed start experiencing symptoms after the age of 20, because by the age of 20, your coping mechanisms are already established, and that's essentially what this is. It's a coping mechanism. By 20, your brain has developed different ways to function. So in severe traumatic events after the age of 20, that's when less than 20% of people would be diagnosed. The name was changed because it's not a fully mature personality. So it went from multiple personality disorder to being dissociative identity disorder because the name in itself was kind of confusing. It's a representation of a disjointed sense of identity. So the host is usually unaware of the other identities unless they're pointed out by an observer. It is not a full personality. So we're going to talk about some myths and bust those. Lindsay?
So the first one is people with dissociative identity disorder have multiple personalities.
So they're not full personalities. I kind of just talked about this, but parts of the host as a whole. So they can be referred to as identities, alters, states of consciousness, or, ego states. But it's not a separate personality. It's not, when we think of personality, we think of like outgoing, bubbly. It's not a separate personality and a different person. It's just a disjointed part of the person as a whole. It's just a safe part that their brain has learned to, when there's a dangerous situation and we want to cope with it, that's where we revert to.
So the second one is dissociative identity disorder isn't real.
It is real. It's been real since, well, it's been recognized by the APA since 1980. But again, movies and TV shows don't show an accurate representation, but a very exaggerated representation of dissociative identity disorder. The United States of Terra was a good show, but it was very much very exaggerated. So again, what you see on TV is not accurate for most disorders because TV doesn't sell. Like, that's why the first thing that you learn about when you're going into acting or directing or writing or journalism is you have to be exaggerating, and you have to exaggerate every single thing that you do as far as acting goes because you're portraying it across the screen. So I could sit here and read like this all day and that would be totally fine. But if I don't liven it up, it's going to get really boring around the 12-minute mark.
So the third one is dissociative identity disorder alters are obvious.
So that's saying that it's pretty obvious when someone is not being themselves. In reality, switching's not usually obvious to an observer. If she had dissociative identity disorder and she switched right now, there's a chance I wouldn't even know. Again, that's where media comes into play. She might be a little disoriented because she is now switched into a different ego state, and it will take her a second, but her body as a whole and her person as a whole is still there, just not intact. So, you know, a lot of people in the movies and media and TV and TikTok is especially a very toxic place for people with mental disorders because they think it's quirky. Will, you know, have you seen the videos I'm talking about?
Yeah.
They're like, they switch and all of a sudden they're like, let me shut the camera off. That's not necessarily how it works. Again, it's going to present differently in everyone, but these really over-exaggerated diagnoses or whatever that these people have don't do any good for people with dissociative identity disorder that still have to function in the real world, because that's not a matter of you're sitting in your room and all of a sudden you're somewhere else and you don't know where you are and you don't know what's happening and you got to turn your phone off really quick. And some people might over time feel like when they are going to switch, if they're in a situation or recalling a memory that's too painful, and then they might like start recording. But I'm not going to get into telling someone what is or isn't true for their own self, but it is very toxic, the culture behind mental disorders and the stigma behind it, which is why we're doing this whole entire thing, because people treat it like a joke and they treat it like it's fun or it's, you know, funny or it's cute or it's weird or it's, look at me, I'm so unique, I have blue hair and I'm 3 different people. It's not a personality state, it's an ego state. There's one person and one personality split into a coping mechanism and a controlled area of self into different identity states. So the treatment really just requires getting the individual to recall and process painful memories and integrate the identities into one person. So that's where psychotherapy, especially cognitive behavioral therapy, comes into play. Dialectic behavioral therapy and eye movement desensitization and reprocessing is sometimes used in extreme cases. Really, you have to, not you as a person, but a clinician would have to make somebody recall a memory that's too painful that causes them to regress into this different identity state, and they would have to face it head on. And over time, they'll be able to integrate all the personalities because the memory or the triggering thought has now been conquered. So you have to change the negative thought, change the way that the person copes with the trauma that happened, and then everything can come together after that. So pretty much like every other mental disorder, dissociative identity disorder is widely misunderstood. Just know that it is a serious disorder. It's not something funny. It's not a cute thing to try and do. It's not like, you know, it's not funny is what I'm trying to get at. So if you know someone or you are someone who has been diagnosed, take it seriously, get that proper help, and we will talk about exhibitionistic disorder next. So let me know if you have any questions about dissociative identity disorder. Bye.